Bonjour à tous. Hello, everyone.
Good morning, everyone.
From coast to coast to coast, vaccination is underway. As of last week, we had delivered close to 1 million doses total to the provinces and territories. There's still a lot of work to do, but these shipments are already bringing relief and hope to communities across the country. Every day, more vulnerable people in long-term care homes and more healthcare workers are getting vaccinated. And in Indigenous and Northern communities too, the immunization campaign is ongoing. Last week on Vancouver Island, 600 doses arrived for the Cowichan tribes. Within just 2 days, every single one had been administered. Over the weekend, 9 Cree communities in northern Quebec received boxes of doses. And in the coastal Inuit community of Nain, Nunatsiavut, Canadian Rangers were deployed and did great work to support the vaccination efforts. This is what teamwork looks like. To everyone who's part of this effort, thank you. When we work towards a common goal, we get results for all Canadians. Now, even with this good news, the situation is still critical. Our fight is not over. That's why we have the plan Canada needs to get you and your family vaccinated as soon as possible and to deal with any roadblocks that come up in our way. For example, Pfizer's global supply issues are not ideal, but that's why we were so ambitious in the large numbers of contracts we signed and doses we secured. I can tell you that Minister Anand is in contact with the company every day. Remember, this situation with the Pfizer delay is temporary. Our vaccination objectives for the first quarter of the year, January to March, are not changing. The total number of doses committed to us is still the same, with every Canadian who wants to get vaccinated able to get vaccinated by September. Quand je dis que tout le monde doit faire sa part,
when I say that everyone has to do their part, I'm also talking to travelers. It's not the time to be traveling abroad. If you had planned to leave the country, please, on behalf of all Canadians, cancel your trip. It's not worth catching COVID-19 and bringing it back to Canada for a trip down south or elsewhere. As you know, travelers must quarantine upon their return, and the consequences are very severe for those who do not follow the rules. As to this new variant of the virus, whether in England, South Africa, or Brazil, we are closely following the situation. But one thing is certain. With these new mutations, circumstances could change very quickly. So once again, we're asking Canadians to stay in the country, especially since, as daily, we are reviewing the new issues and we could impose new restrictions without advance notice at any time. More than ever, before, during this pandemic, your behavior has consequences for others. Continue to be vigilant. We must continue to help one another. When we don't follow the rules, healthcare workers and the most vulnerable members of our population are at risk. Remember, this is a temporary situation. Vaccines are being deployed. Let's stay strong for the next few months, because just like you, I'm really looking forward to spring.
It is absolutely critical that everyone keeps doing their part to slow the spread of COVID-19. We owe it to ourselves, to our families, and to everyone around us. Vaccines are coming. In a few months, spring will be here. So now is not the time to abandon our efforts. I think of the tragic and unacceptable situation in long-term care facilities in Ontario and across the country. Our parents and grandparents deserve better. Our nurses deserve better. So to the residents, we are doing everything we can to get you your vaccine as quickly as possible. And to the workers, I know your families are worried as you are worried about them. I know that your kids are afraid to lose you every time you go to work, and you're afraid of bringing home the virus. So if you haven't already received it, we're getting you your vaccine as soon as possible. So thank you for everything that you do, your dedication, your commitment to Canadians impresses us all. There's a lot more work to be done, but we're making important progress. Last Friday, Mayor Watson here in Ottawa said that all long-term care homes in the city have finished their first round of vaccination. In Quebec, 3/4 of long-term care home residents have had their first shot. More doses are coming, and we won't stop until everyone is safe. Alors que des mesures plus strictes pour freiner le virus ont été
While
annoncées par
stricter measures
plusieurs provinces dans les dernières
have been
semaines,
announced by several provinces over the last few weeks, many people continue to fear for their jobs and their future.
notre gouvernement a mis des programmes en place pour
Our
vous
government
aider
has
et nous allons
implemented
être là pour
measures
vous
to help you,
tout aussi
and we are here
longtemps
to help
qu'il
you
faudra.
as long as need be.
Pendant la retraite du Conseil des ministres,
During
l'équipe
the
s'est
cabinet
penchée sur
retreat,
notre stratégie
the
pour
team
continuer de soutenir les
reviewed
familles,
our
les
strategy to
travailleurs
continue
et
to
les
support
entreprises.
families, workers, and
Pour nous
businesses.
dresser un portrait économique national
In
et
order
global,
to
nous avons reçu la présentation
get
de
the
deux
overall
experts,
economic picture,
Kevin
we
Milligan de
received
UBC et
presentations
Francis
from two
Donald
experts,
de
Kevin Milligan from
Manulife.
UBC and Francis
Nous avons
Donald
aussi parlé
from
de la
Manulife.
relance.
We also who talked to us
As
about the
Canada
recovery.
recovers from this global crisis, we want to make sure that everyone, every worker, parent, and young person lands back on their feet. To help do that, part of our strategy is ensuring that Canada becomes the global clean tech leader and that Canadian workers be at the forefront of that vision. On that note, it's great to see that Unifor members ratified their agreement with GM Canada to build battery electric commercial vans here in Canada. Including this agreement, deals that have been announced over the past few months have secured nearly $6 billion of investments in the Canadian automotive sector. These deals are protecting and creating good middle-class jobs, and they're creating new opportunities right across the country. With these investments, Canadian automotive workers and businesses will continue to lead in growing markets for efficient, electrified, and smart vehicles. Like we said when we presented our climate plan, a healthy environment and a healthy economy, clean technology presents enormous opportunities for economic growth and jobs. When a project is good for workers, for growing the middle class, and for protecting the environment, everybody wins. There's still a lot of work to be done to rebuild a stronger, cleaner, and more inclusive economy, and announcements like these are exactly what we need to get there. Before we end today, I'd like to say a few words about this week's inauguration in the United States. Tomorrow, Canadians and people around the world will be watching the swearing in of President-elect Biden and Vice President-elect Harris. This moment will mark a new chapter in the incredible relationship between our two countries. I also want to address reports surrounding the Keystone XL project. Yesterday, I spoke with our ambassador, Kirsten Hillman. We've had a clear and consistent position supporting this project for years. Our government is making sure that Canada's views are heard and considered by the incoming administration at the highest levels. And of course, I'm really looking forward to working closely with the new president and his team to create jobs and build back better for us all. Merci tout le monde.
Thank you, everyone. Thank you, Prime Minister. We'll begin question period over the phone. Operator?
Thank you. Merci. Première question, Catherine Nevers, Presse canadienne.
First question, Canadian Press.
Oui, bonjour, Monsieur Trudeau.
Yes.
Vous venez de
Good
dire
morning,
dans votre
Mr.
allocution
Trudeau.
que votre gouvernement
You just said that your
pourrait
government
imposer de
could
nouvelles
impose
mesures aux
new
voyageurs
restrictions
sans préavis.
upon travelers
Je voulais
without
savoir
advance
quelles
notice.
mesures est-ce qu'on parle
I'd like to know
exactement
which
de
measures you
pour
mean
mieux commencer?
specifically. What is it that
Comme
you're
j'ai dit,
considering?
on est en train de regarder
Answer.
avec beaucoup
As I
d'attention
said, we
la
are
situation,
closely
particulièrement les mutations qu'on voit
watching the
ici et
situation,
là,
especially the
partout,
mutations
dans
that
le
we
monde, et
see
on veut
here and there across the
absolument
world.
tout faire pour protéger
We want to do
les
everything we
Canadiens
can to
ici au
protect
pays.
Canadians here in the
C'est
country.
pour ça que nous recommandons
That is why
fortement que
we
personne
strongly
ne prenne
recommend
des voyages
that
non
no
essentiels
one take
et que nous
non-essential
continuons à avoir
trips.
parmi les mesures les plus
And
strictes au
we
monde
continue to have
par
some of
rapport
the
à la
strictest
quarantaine, par rapport à la
measures
dépistage
in the
avant,
world when it
le
comes to
retour de
quarantining
voyage,
and
pour
tracing
s'assurer que les
when
Canadiens
before and after
continuent
people travel,
d'être
to ensure that
protégés, mais
Canadians are
évidemment, on
properly
continue de
protected.
regarder la situation
But also,
et,
of
on
course,
va prendre
we
d'autres
continue to
décisions,
keep a close
si nécessaire.
eye on the situation, and we'll make make further decisions if necessary. Supplementary question, Catherine? Question, yes, I'm just trying to understand what your message is today. Is it a warning? Is it a threat to travelers? Are you telling them, come back now? Because we may be imposing further measures without advance notice. Answer, I think that what people saw when we imposed measures around Christmas, when it comes to having to provide a negative test before returning to Canada, we are always prepared to add additional measures. We recognize that the Constitution allows people to travel, but at the same time, we have the obligation and the right to impose very strict measures and strict penalties for those who are endangering Canadians' health. So, with our quarantine measures, with our tracing measures, and with our recommendations to avoid travel, we hope that we can continue to protect many Canadians and to protect Canadians well. But if need be, we will impose further measures.
Thank you. Merci. Prochaine question, Émilie Bergeron.
Next question, Émilie Bergeron. Agence qui... Hello, Mr. Trudeau. You said this morning that you wanted to ensure that Canada's positions ahead were taken into account by the Biden administration. Have you already spoken to Mr. Biden to try to dissuade him from cancelling the pipeline? Answer, as you know, I've been supporting this Keystone XL project for years. I made this argument 7 years ago in a room full of Democrats in Washington, even before I became Prime Minister. I did speak to this project directly to President Biden, showing that and demonstrating that the situation had changed a good deal since he was Vice President when we had Prime Minister Harper. We are speaking with the highest levels of the incoming administration to promote our arguments in support of this project once again. And I trust that we will be heard, that our arguments will be considered during their process.
I have been very clear over the past 7 years that I support the Keystone XL project. We have made that case, including in front of a room filled with Democrats 7 years ago in Washington, D.C., before I became Prime Minister. We have highlighted, including in a direct conversation I had with President-elect Biden a number of weeks ago, that Canada has, in the intervening few years, become a global leader on the fight against climate change and moving forward on transforming our economy in positive ways to reduce carbon emissions, and that Keystone XL continues to be an important project for us. Over the past number of days and continuing today, we are communicating our arguments in favor of Keystone XL directly to the highest levels of this administration, and we will continue to work closely with them on this and many other initiatives to protect jobs and grow the economy in ways that also fight climate change.
Follow-up question, Emilie? Yes. Are you considering legal means, such as those suggested by Premier Jason Kenney of Alberta? I'd also like to hear about Pfizer. The European Union apparently it will only be affected for 1 week in terms of the Pfizer delays, whereas here in Canada it's 4 weeks delay. What do you have to say about that? Answer, well, I plan to speak with Premier Kennedy later today to understand his perspective and his position fully. When it comes to Pfizer, we clearly saw that we will be able that we will ensure that the contract, that they abide by their contract and that we receive all the promised doses in the first quarter of 2021, and that we will continue to be there and vaccinate the greatest number of Canadians as quickly as possible. Obviously, with this new production of vaccines across the world, we did expect there to be certain challenges for some of the companies, which is why we ensured we had a plan by signing contracts with a large number of vaccine producers so that we could have more doses per resident than any other country does. And Minister Anand continues to speak with Pfizer representatives every day to ensure that Canada will continue to receive the doses we need so badly.
We always knew that in manufacturing global vaccines at the scale that is going to be needed to end this pandemic, there were going to be challenges for certain companies in certain situations, which is one of the reasons why we took extra care to sign more contracts with more potential vaccine makers than most of our allies, and indeed have secured more doses per person than any other country, because we knew there would be challenges. But even with the announced delays by Pfizer, we are confident we're remaining on track to receive all the promised doses we had signed for by the end of Q1, and indeed that all Canadians will be able to be vaccinated by September 2021.
Thank you. Operator, one last question on the phone.
Thank you. Merci. The next question is from Ryan Tumulty, National Post. Line open.
Yeah, good morning, sir. I wanted to ask you about the vaccine rollout, and specifically, I guess, it seems like the flaw in the strategy so far is the relatively few doses Canada is getting in Q1. I know it's said to scale up after that, but can you explain why Canada is getting so few doses in Q1? Was this all that was available? Were we not willing to meet prices that the drug manufacturer set? What was the challenge?
The challenge is, as of December 1st, 2020, there were none of these vaccines being produced anywhere in the world for general use. They were all in testing and trials, and the scientific community and scientists around the world and manufacturers did Herculean efforts in order to achieve an effective vaccine, actually many different effective vaccines against this pandemic in record time, while ensuring the safety and the efficiency of vaccines for people to use. This was a tremendous undertaking, and well before anyone knew which vaccines would be most effective, Canada made the decision to sign contracts with more potential vaccine makers than most of our allies, and actually secured more doses per capita for Canadians than any other country did for their citizens. Now, we recognize that standing up manufacturing processes take time, and that's why we've ensured to be part of the very first wave of vaccinations of any country around the world, and we continue to receive doses. The Pfizer manufacturing facility in Belgium is retooling to be able to produce even more vaccines for distributing to countries and people who need them, and that is causing a momentary delay in their production, but we have been assured by Pfizer that we will still be able to meet our commitments to Canadians as they will meet their contractual obligations to Canadians. Efforts will ramp up around the world as vaccine production increases around the world, but companies are ramping up production step by step, as is necessarily the case for a brand new series of vaccines.
Following up, Ryan?
Yeah, and Sarah, we're hearing reports out of Europe that the Pfizer doses are not being delayed for as long or not being reduced as significantly in several European countries as compared to Canada's orders. Can you explain that difference, why we're having a longer reduction and a deeper reduction?
I've understood that there are many different musings and reports and speculations and stories about this country doing this, about that country doing that. I had a lovely conversation with Angela Merkel yesterday morning in which she sort of complained to me that every day she gets it from the German media that they're not doing as well as Canada is. I think a lot of people are comparing stories from country to country and trying to figure out how we can all move quicker. I can assure you that Minister Anand is talking almost daily with Pfizer and the other vaccine companies to ensure that we get as many doses as possible as quickly as possible, and that work will continue. We will not rest. We will not slow down until we get as many Canadians vaccinated as quickly as we possibly can so that we can all get through this pandemic. Okay.
I understand that across the world people are watching what's happening in this country or that country to try and compare and see if we're all doing the right things. Everyone is working as hard as possible to ensure that they obtain vaccines as quickly as possible, as many doses as possible, and that's what we're trying to do too. I had a wonderful conversation with Angela Merkel, Germany's Chancellor, yesterday. She said that nearly every day she was being criticized by German journalists because she hadn't done as well as Canada. And I assured her that I'm being criticized every day and asked why haven't we done as well as other countries. This is the situation in which we find ourselves. I can tell you that we are working day and night with constant calls to vaccine producers to ensure that we receive as many doses as possible, as quickly as possible for Canadians. Because we all want to get through this pandemic as quickly as possible.
Prime Minister Michael Couture with Global National. I just wanted to pick up on that. Those reports are suggesting that political pressure has worked. In fact, Israel's president is boasting that he's had 17 calls with the CEO of Pfizer. I know you said that Minister Anand is constantly in contact with them, but what are you doing, if anything, to try and put pressure on these companies to actually respect the contracts we've signed?
The companies are respecting the contracts that we've signed. We will receive the doses that were committed by the end of Q1. We will have Canadians vaccinated, everyone who wants it, by September. These are the things that we've committed to Canadians, and we continue to work every day reaching out to the top levels of vaccine companies, including myself being involved, to ensure that we are getting the doses we need.
Hi, Prime Minister. Tom Parry, CBC. The World Health Organization has an interim report out today, or yesterday, about the global pandemic response. It talks about the WHO being slow to declare a pandemic and countries around the world being slow to respond. I know you've said there will be a time for Canada to look at the lessons learned from all this, but I'd love to get your response to this report. And also, do you think that Canada and other countries should have been better prepared for this pandemic?
We're, of course, looking very carefully at this interim report and seeing how we can apply those lessons, not just for future challenges, but right now to Canada's pandemic response. Obviously, there are things looking back that we could have, should have done differently. And I think one of the most important things as we move forward is making sure that we learn from this experience for future governments and future administrations. I can tell you that the experience of SARS in 2003 left Canada significantly better off and better prepared than many other countries for dealing with this pandemic. But even then, there were other things that we might have done that we didn't quite do in time, and that's why we're always going to be learning about how to better keep Canadians safe and how to better prepare for eventualities like this in the future.
Bonjour, Monsieur Trudeau. Laurence Martin, Radio-Canada.
Good morning, Mr. Trudeau. Laurence Martin, Radio-Canada. When it comes to travel abroad, we understand that you wish people to avoid traveling at all costs. But now there is a break coming up. Are we going to, during the March break, are we going to try and prevent all Canadians from traveling during March break? Answer, we have a constitution that guarantees the right to the right of freedom of movement to all Canadians. However, I must emphasize that the measures we have implemented are not only there to discourage people from traveling, and with the 2 weeks of mandatory quarantine with severe penalties, as well as tracing before returning back to Canada and providing a test, and other measures that we've implemented. It's not just to discourage people from traveling, there are also measures that will ensure Canadians are protected. We are always speaking to our provincial counterparts as well as other partners to see if we need to impose further measures, including when we're talking about upcoming break weeks, and eventually Canadians who spend the winters down south, and when they begin to return to the country in the spring, we're going to look at everything we can do to ensure Canadians are protected.
Prime Minister Kevin Gallagher, CTV National News. Conservative leader Aaron O'Toole has said that he'd like to kick Derek Sloan out of the Conservative caucus. They're going to have to decide about that for Mr. Sloan accepting donations from Paul Frum, self-described white nationalist. But Mr. Frum's organization has also reportedly received money for the Canadian wage subsidy. So my broader question is, what can be done here for the government and for political organizations like the Liberal Party to avoid from infiltration of far-right groups that may be trying to get into the Canadian political sphere and use public money in some way as well?
I think, Kevin, you're combining a number of different things. First of all, political parties need to remain vigilant, particularly in the wake of what we've seen in the United States, from the infiltration or the active presence of fringe or extremist or violent or unacceptable or intolerant elements. And that's something that we constantly need to work towards as all politicians in Canada, which is incidentally why the Liberal Party has been calling for Aaron O'Toole to remove Derek Sloan from caucus for many, many months now, following a number of unacceptable comments that he has made. We are pleased that Aaron O'Toole has finally decided to take leadership, and we'll see how that unfolds. In regards to the wage subsidy, we knew we had to move quickly to support workers in jobs right across the country. And obviously, that meant sending help immediately to families and to individuals when this pandemic hit back in March, so that people could keep food on the table, could continue to pay their rent, regardless of the job or the organization they worked for. Obviously, that requires checking after the fact, and there is a lot of work ongoing with the Canada Revenue Agency and others to ensure that the companies that received and the workers that received these benefits actually needed them and actually qualified for them. And of course, anyone who is found to be breaking the law as a corporation or as an organization will face severe penalties.
Stephen Chase with the Globe and Mail. Good morning, Prime Minister. At least 3 publicly traded Canadian resource companies, have active projects and plans in China's Xinjiang region, where a large number of Muslims are locked up in concentration and labor camps. These are Canadian Solar Incorporated, Dynasty Gold Corporation, and Gobi Min Incorporated. Can you assure Canadians that these companies are not using forced labor and are not contributing to human rights abuses of Chinese Muslim minority? And has the government taken any steps to speak to these companies?
We have been increasingly concerned over the past many years on the treatment of the Uyghur minority in Western China. We have highlighted that many times directly, both in global multilateral forums and directly with the Chinese government in meetings and conversations that I've had over the past years with their leadership. Over the past number of days, we've announced further measures around restrictions on benefiting from labor used in the region that may be forced labor by the Uyghurs. We are working with Canadian companies, all Canadian companies, to ensure that they are not benefiting from or profiting from these human rights abuses. We will continue to work very, very closely and follow up with the companies you named and all companies who have investments in that area to ensure that they are following Canadian values and Canadian law.
Hello, Prime Minister. Mike Blanchfield, Canadian Press. Can you give us a bit more detail You've told us what you've done on Keystone in the past. What do you plan to do tomorrow after Biden is inaugurated? I mean, are you going to call him directly? Are you going to try to persuade him to delay this action? Would you support legal action by the Alberta government if it comes to that? Can you give us some specifics about what's next on Keystone for you?
Like I've said, I've been very, very clear on my support for this project for the past 7 years. I have continued to work with American officials and members of various administrations on promoting and demonstrating the importance of this project from a jobs perspective, but also from an energy security perspective. I brought up this issue in my very first conversation with President-elect Biden before Christmas. Our officials in Washington have continued to make the case for Keystone XL. We understand, of course, that it is a commitment that the administration made many months ago, or the candidate Joe Biden made to cancel this pipeline. At the same time, we continue to demonstrate the leadership that Canada has shown on fighting climate change and on ensuring energy security as a priority for North America. We're going to continue to make that case, and I look forward to speaking with Biden, with President Biden in the coming days to talk about this and many other issues that we will work on together as we build back better and as we fight COVID-19.
Merci beaucoup. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Thank you very much. This brings today's press conference to a close. Thank you, everyone.
Bonjour à tous. Hello, everyone. Welcome to
everyone.
today's press conference. Bienvenue à la conférence de presse d'aujourd'hui. Je passe la parole au ministre Jean-Yves Duclos.
We will begin with Minister Jean-Yves Duclos.
Bonjour tout le monde. Good afternoon,
Hello,
everyone.
everyone.
Thank you for joining us on this call. I'm delighted to be in the wonderful company of Minister Anita Anand, who is Minister of Public Services and Procurement, Major-General Dany Fortin, who is the head of logistics at the National Operations Center, will also speak to us shortly, followed by Dr. Tam, who is the Chief Public Health Officer at the Public Health Agency, and Dr. Howard New, who is Deputy Chief Public Health Officer at Canada's Public Health Agency. Before I turn to my colleague, Minister Anand, let me summarize briefly what the Prime Minister said this morning. First, that there is light at the end of the tunnel. We are obviously focused very much on the short-term epidemic and the crisis. We obviously also want to keep in mind that there will be an end in this tunnel, and that spring will come and better conditions for everyone will occur, and that will happen more quickly if we continue to look after each other, follow closely the public health advice, and not to travel. Le Premier ministre a été très clair tout à l'heure.
The Prime Minister was quite clear earlier. The directives have always been the same. Avoid non-essential travel, certainly those outside the country, in order to protect your own health and also protect the health of those around you.
Major-General Fortin will have further information to share with us. However, the key objective is the same. It's to vaccinate every Canadian that wants to be vaccinated by September. Our medium-term objective also remains the same, to have Canadians being delivered 6 million vaccines by the end of March, and that being done in the most rapid and the most efficient manner, but also in full collaboration with provinces and territories that have the important and challenging and difficult work to administer the doses in Canadians' arms. And
in closing, the Prime Minister also mentioned two important messages. Firstly, the link between people's health and our economic health. We learned that over the course of the pandemic, and we will keep this in mind, that while looking after people's health, we will also be looking after our economic health. He also alluded to the fact that once we're through this public health crisis, there is an environmental crisis that we will continue to work on to ensure, as we've always said, our environmental health is also linked to our economic health.
With this being said, I would now be pleased to turn to my colleague Anita for her remarks.
Thank you very much, Jean-Yves. Hello, everyone.
Let me begin by thanking Canadians for following public health guidance to help slow the spread of the virus at this pivotal time. The sacrifices being made to protect families, friends, and fellow citizens are very difficult, but essential. En plus des vaccins qui seront essentiels pour vaincre la COVID-19,
On top of the vaccines that are essential to conquer COVID-19, we must continue to adhere to the guidance that Dr. Tam and New continue to share.
Our government pursued a diversified vaccine procurement approach. Given global demand for products emanating from a limited number of suppliers, we knew that we would likely need to weather challenges with supply, given complex manufacturing, unprecedented global demand, and rapid acceleration to peak production. We clearly saw this last week with news from Pfizer of temporary disruption delays. This was very disappointing, and I spent the weekend on the phone with Pfizer executives and my team. We reiterated firmly the importance for Canada to return to our regular delivery schedule as soon as possible. Pfizer assured us that it is deploying all efforts to do just that. This is an evolving situation, but I will continue to update Canadians as soon as I have additional information. This is the reason that I'm here today and that I will return to continue to update Canadians. Il est important de se rappeler cependant qu'il s'agit
It is
d'un
important to
retard
remember, however,
temporaire.
that this is a
Le
temporary
Canada
delay.
recevra la
Canada will
totalité
receive
des doses
its
qui lui
full
sont
allotment of
dues
doses
ce trimestre.
this quarter.
Bien que cette nouvelle puisse être considérée
While
comme
this
une
news may be
reverse,
viewed as a
je
setback,
tiens à rappeler aux
I want to remind
Canadiens
Canadians
où nous en
where
sommes.
we stand.
In addition to Pfizer, we continue to receive steady deliveries of Moderna doses. Those deliveries remain on track. By the end of March, we too, as a country, will remain on track. We expect to have 6 million doses of Moderna and Pfizer in Canada and 80 million doses by the end of the year, the vast majority of which will be delivered before the end of September. And we have agreements in place for 5 additional vaccine candidates, which we will bring to Canada as soon as possible once they receive regulatory approval. Let me be very clear in terms of assuring Canadians. We will have enough vaccines in Canada for everyone who wishes to be vaccinated prior to the end of September 2021. Over the coming months, especially into the spring, Canadians, including the provinces and territories, will begin to see a dramatic increase in vaccine deliveries. Au cours des prochains mois, surtout au printemps, les Canadiens
Over the coming
commenceront à
months,
voir une
especially into the
augmentation
spring,
spectaculaire
Canadians
des
will begin
vaccins
to see
livrés.
a dramatic
It
increase
is
in vaccine
possible
deliveries.
that we will see additional supply challenges along the way. And again, this is precisely why we have multiple agreements in place with multiple manufacturers. The road forward may not be as straight and smooth as we would like, but we will together cross the finish line. By working together, we will succeed. We will overcome COVID-19 and get through this together. Thank you so much. Magwach. Merci beaucoup.
Merci beaucoup, Anita.
Thank you very much, Anita. Major-General Fortin.
Major Général Fortin, votre caméra et votre son
Major
sont
General
désactivés.
Fortin, your camera and sound are both disabled.
Ça devait arriver une fois, ça m'est arrivé à moi.
So sorry, it had to happen once, and it happened to me.
Bonjour, mesdames et messieurs. Alors, j'aimerais
Hello, ladies and gentlemen.
Pfizer,
I'd like to talk to you about Pfizer, the reduction in doses, and tell you a bit about Moderna too. So first of all, in terms of the reduction of the Pfizer doses, I'd like to thank you for your comprehension. And as we work on Pfizer's fluctuating availability over the coming weeks, as announced Friday, and as reiterated by the Minister just now. It's a fairly major reduction in Pfizer doses for over the next 3 weeks, and then things will return to normal. There will be a considerable impact in all provinces, of course. The overall impact over the coming month means that we'll receive 50% fewer doses than we expected, and this impact will vary from 1 week to the next. So this week, for example, as our delivery was about to leave the manufacturer's site in Europe, we will receive 82% of this week's allocation. And that we expect to receive by the middle of this week. But next week's delivery will be affected. And Pfizer informed us this morning that there will be no shipping of the Pfizer vaccine during the week of January 25th. So, whereas Pfizer's numbers will continue to stabilize in the coming weeks, things will bounce back up in February, and the numbers for the first 2 weeks of February have yet to be confirmed. But we are being assured that the doses we receive will be fairly distributed amongst the various countries. And we hope to receive an update from Pfizer this week as to the shipment we can expect during the first 2 weeks of February. And we will be able to share that with you by Thursday. We're closely following the situation. Obviously, Pfizer's goal is to deliver 4 million doses by the end of this quarter, the first quarter, so by March 31st. Now, with respect to Moderna, we continue and plan to receive 230,000 doses during January and in the coming days. And as previously mentioned, Moderna's deliveries are laid out over the next 3 weeks.
For their flexibility and their patience as we work through the fluctuations of Pfizer allocations over the next several weeks. In general, we anticipate a significant decline in Pfizer supply over the next 3 weeks, followed by a ramping back up of supply. There will be considerable impact across all provinces, asymmetric across the board. The overall impact over the next month is in the range of 50% decrease of expected allocations. But this impact, as I said, will be asymmetric. This week, as our shipment was being prepared, there is minimal impact. And in fact, we're receiving 82% of what we had originally planned on receiving. And that's the distribution is currently on the way, and we expect to have this done by mid to end week. However, next week's deliveries have been deferred by Pfizer in their entirety. To clarify, we're informed by Pfizer this morning that that the Pfizer vaccine to Canada in the week of 25 January. It will start back up in the first 2 weeks of February to expected numbers, modified numbers as we shared last week. So about half of what we had originally expected. But those numbers remain to be confirmed by Pfizer Canada. In fact, we have regular conversations with them, and we hope and we expect to have clarity on those numbers in time for Thursday with regards to the first and second week of February. Numbers are expected to go back up to what we had originally planned, and Pfizer continues to tell us that they expect to be able to deliver up to 4 million doses of Pfizer vaccine by the end of this quarter, so by the end of 31 March. A quick word on Moderna. Moderna is delivered on a 3-week cycle. We continue to plan on receiving 230,000 doses of Moderna product in the first week of February, and the follow-on shipments are unaffected at this time, and we'll continue to provide clarity on those numbers as we move forward. Merci beaucoup. Thank you very much.
Merci beaucoup.
Thank you very much, Major General Fortin. Dr. Tam.
Bonjour à toutes et à tous. Welcome.
Good afternoon, everyone.
Virtual press conference. My colleagues and I in Ottawa are trying to do our part in reducing contacts as much as possible. So there have been over 715,000 cases of COVID-19 in Canada, including 18,120 deaths and nearly 74,000 active cases across the country. So nationally, the average case count is now close to 6,700 new cases being reported daily over the past week, with a still increasing number of people experiencing severe illness. There are an average of about 4,775 individuals with COVID-19 being treated in Canadian hospitals. Over 880 of them are in critical care, and over 140 deaths are being reported each day. Canada continues to monitor for virus variants of concern. To date, the National Microbiology Laboratory has verified 23 cases with a variant first reported in the United Kingdom, and 2 cases with the variant first reported in South Africa. By now, we have seen time and again that our actions matter, as we've watched COVID-19 trend up and down and up again, and we are reminded that our actions have consequences. Every time we get a little too tired or a little too excited about holidays or thinking that vaccines could give us a quick shortcut, we are met with a new spike of activity as COVID-19 tries to take the lead again. We have also come to realize that we're not all on equal footing and that some in our communities need additional support to be able to keep themselves and their loved ones safer. Last week's National Epidemiology and Modeling Update was the latest reality check. Of course, we're all tired and want this to be over and ultimately to win against this virus. But we are again at a pivotal moment where there is a great deal at stake. As cases accumulate ever more quickly, hospitalizations, critical illness, and deaths will continue to rise. It is incumbent upon all of us to prevent more of these tragic consequences. Redoubling our efforts and not letting up is the difficult work we need to do now. The consequences of these actions are the compound benefits we all want. By suppressing COVID-19 disease activity, we're all contributing to reducing the burden on the health system, supporting our healthcare workforce in the difficult task of planning and implementing mass vaccine rollout, and giving vaccines a longer runway to begin to work as access expands to reach all Canadians. For all we have been through and all we stand to achieve in the months ahead, we owe it to ourselves and all those we have worked to protect thus far to see this through and save every life we can. Every vacation travel we postpone for a better time in the future. Every outing or activity we avoid, shorten or limit to essentials. All the diligence we apply to hand washing, masking, and spacing helps to reduce spread of the virus. This is the tough part of the COVID-19 marathon. Together, it will be easier. Thank you.
Bonjour à toutes et à tous.
Hello, everyone. There have been over 715,000 cases of COVID-19 in Canada, including 18,120 deaths and nearly 74,000 active cases across the country. Nationally, the average case count is now close to 6,700 new cases being reported daily over the past week, with a still increasing number of people experiencing severe illness. There are an average of about 4,775 individuals with COVID-19 being treated in Canadian hospitals, over 880 of whom are in critical care, and over 140 deaths are being reported each day. Canada continues to monitor for virus variants of concern. To date, the National Microbiology Laboratory has verified 23 cases with the variant first reported in the United Kingdom and 2 cases of the variant first reported in South Africa. By now, we have seen time and again that our actions matter. As we've watched COVID-19 trend up and down and up again, we are reminded that our actions have consequences. Every time we get a little too tired or a little too excited about holidays or start wishfully thinking that vaccines could give us a shortcut, we are met with a new spike of activity as COVID-19 tries to take the lead again. We have also come to realize that we're not all on equal footing, and that some in our communities need additional support to be able to keep themselves and their loved ones safer. Last week's National Epidemiology and Modeling Update was the latest reality check. Of course, we're all tired and want this to be over, and ultimately want to win against this virus. But we find ourselves again at a pivotal moment where there is a great deal at stake. As cases accumulate ever more quickly, hospitalizations, critical illness, and deaths will continue to rise. It is incumbent upon all of us to prevent more of these tragic consequences. Redoubling our efforts and not letting up is the difficult work we need to do now. The consequences of these actions are the compound benefits we all want. By suppressing COVID-19 disease activity, we are all contributing to reducing the burden on the health system, supporting our healthcare workforce in the difficult task of planning and implementing mass vaccine rollout, and giving vaccines a longer runway to begin to work, as access expands to reach all Canadians. For all we have been through, and all we stand to achieve in the months ahead, we owe it to ourselves and all those we have worked to protect thus far to see this through and save every life we can. Every vacation travel we postpone for a better time in the future, every outing or activity we avoid, shorten, or limit to essentials, all the diligence we apply to hand washing, masking, and spacing helps to reduce spread of the virus. This is the tough part of the COVID-19 marathon. Together, it will be easier. Thank you. Thank you very much, Dr. New. And now we are delighted to answer your questions. Thank you. We will begin the question period. And as a reminder, it's one question with one follow-up question each.
Question period. Every reporter gets one question and one follow-up question. All questions today will be on the phone. Opérateur, c'est à vous.
Operator, over to you.
Merci. The first question is from La première question est de Rachel Haynes from CTV. Please go ahead. À vous la parole.
Hi, everyone. Rachel Haynes here from CTV National News. I just want to go back to what we're talking about, how last week we were told that this was going to be equitable across all countries. However, now it seems that Canada is getting worse hit than European countries who have said over the weekend that they're now going to be getting their dosages and their vaccines restored next week. So what have the conversations been with Pfizer about this inequity that Canada seems to be experiencing, especially now as they are deferring the January 25th deliveries that we were supposed to be getting?
Before I turn to perhaps Anita.
Go ahead.
Before I turn to Anita and possibly to Major-General Fortin, let us be all mindful that we've been very successful until now in having excellent relationships with both Pfizer and Moderna. And that's why we have been the second country in the Western world, first to approve and then to administer after the UK, the Pfizer vaccine. We have been the second country in the Western world, first to approve and then to administer the Moderna vaccine after the US. So we've been demonstrating over the last few weeks that we are fully in touch and in great collaboration with the country, that we're also very focused, and Minister Anand and Major General Fortin might want to reinforce that focus on the medium-term objective of securing our agreement with Pfizer, which is 4 million doses in the first quarter, that is between now and the end of March, with, as we've said earlier, the ultimate objective of vaccinating every Canadian that wants to be vaccinated by September. But Minister Anand might have something to add, perhaps to correct or to clarify. And the same thing for Major-General Fortin.
Well, thanks, Jean-Yves, and thanks, Rachel, for the question. I want to, first of all, state that I spoke with Pfizer over the weekend. I insisted on equitable treatment in terms of global supply reductions that it had announced. And indeed, Pfizer assured me and Canada of equitable treatment. Canada remains on track to receive the 4 million doses that Pfizer previously committed to arrive before the end of March. And with the 2 million doses of Moderna, which are also on track, we remain on track to receive the 6 million doses as we have previously stated. The reduction is a temporary one, and Pfizer Canada has assured us that we will have our full allotment, and I believe that Europe will also receive its full allotment. In terms of the way in which Pfizer is ensuring that it meets its quarterly allotment commitments, those are questions that Pfizer needs to answer as opposed to me, because I don't have the answers regarding Pfizer's decisions. But we have been assured of equitable treatment, and we have been assured that we will receive the 4 million doses from Pfizer as previously promised. Thank you.
I can perhaps just compliment Minister Anand's answer by saying that the discussions that we had all the way to this morning very much complement what Minister Anand has had in terms of clarifications from Pfizer. The manufacturer has reiterated that they're applying this significant reduction across the board. Some countries have been impacted more severely this week. We have not, very lightly impacted. Our impact is more severe next week. We're expecting to receive some. We're now saying that our entire expected shipment is deferred for next week, and then the numbers will start to pick back up in the first weeks of February.
Follow-up question?
Yes, thank you. I understand about what you're saying, Major General, about some countries having been more impacted this week. However, some countries like Spain, we're seeing only about a 50% reduction this week, and then their delivery schedules, again, we're picking up the week following, whereas it seems that we're having a bit more of a reduction and no end, or not as quick as an end to those reductions. But in terms of further reductions in supply, Minister Anand, you mentioned in your comments about it's possible that we're going to be seeing further supply issues. Has Pfizer made any guarantees that we won't be seeing any further reductions in their supply? Are there other options that Canada consider, like perhaps paying more for vaccines so that we don't continue to see any reductions?
Thank you so much. One of the positive moments in the conversation with Pfizer was indeed the assurance that we received that they remain on track to deliver the allotment for Canada that had been promised. And together with the Moderna shipment, we are on track for our Q1 deliveries. Having said that, in every conversation that I have with every supplier, I am reiterating the importance of earlier and earlier deliveries, including in Q1. And that will not change. Every conversation that I have, I will stress the urgency of the situation, that Canada is in, and I will stress the importance of having doses in this country as soon as possible. Thank you.
Merci. Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque de la Presse canadienne.
The next question is from Canadian Press. Please go ahead.
Oui, bonjour à vous tous.
Yes,
ma
good morning to all of you.
Madame Anand, corrigez-moi si je me trompe.
My question is for Minister Anand.
Plus qu'on recevra les quelques.
Correct me if I'm wrong.
Je pense que c'est 1,2 ou 1,4
But I think we're receiving 1.2 or 1.4 million doses of Pfizer vaccine between now and February, the end of February. So what about the 4 million doses in the first quarter, by the end of March? Do you think those numbers are going to go down? Do you foresee any particular problems?
I will begin responding, and then I will hand it over to Major-General Dany Fortin. In the first instance, I think we have to remember that the shipments that we are receiving have been allocated to Canada, and that chaque fournisseur essaie
and that each supplier is trying to meet their obligations under their contracts. It's very important for suppliers and for us as well. But at this time, I don't foresee further interruptions with these contracts or shipments, because we've already spoken with Pfizer as to the importance of meeting their obligations towards us.
In other words, we, in our conversation, stress the importance of sticking to the new schedule once it is ascertained, and ensuring that Canada receives the allotment of Pfizer doses that it has been promised.
But, as I've already said, it is also important to reinforce each time we speak with suppliers, with Pfizer, with Moderna, that we must receive the doses here in Canada. That is the most important thing for me. And I reiterate that every time I speak with our suppliers. And now, I will hand the floor to Major-General Dany Fortin.
Merci, Madame la Ministre.
Thank you, Minister. You know, since the beginning, since December 14th, we have received and delivered over 1 million doses of vaccine between Pfizer, BioNTech, and Moderna vaccines, and that will continue. As I mentioned, we now have an obstacle. And the result of that obstacle is that we've received half the number of doses we were supposed to over the coming 4 weeks. Very little impact this week, severe impact next week, more severe than we were initially expecting. So let's have a look at the following weeks. There will be an increase in February, and we still expect to receive the 4 million doses by the end of March. What this will mean concretely in terms of February? Well, of course, we will have fewer doses than we were anticipating at the beginning of the month, since they will come in at a slower rate at the beginning of February, but we expect the growth to ramp up by mid-February and going forward until the end of March. So they have to respect their contractual obligations. So there will be a substantial increase in weekly deliveries by Pfizer BioNTech from mid-February to the end of March. Let's not forget that afterwards there will be a considerable increase of both approved vaccines over the month of April. So while all this poses real challenges for us, we will be prepared for the second quarter of this year in terms of preparing to receive for significant increase in receiving and distributing vaccines across the country. All right, so if I've correctly understood you, in the short term, with respect to the beginning of February, we still don't know how many doses we'll be receiving from Pfizer. And my follow-up question is still for you, Minister Anand. I would like to know the Quebec's decision to delay the dose for up to 90 days. Did that complicate the negotiations with Pfizer? Is that one of the reasons that explains why we're finding it more difficult to explain to obtain explanations and answers from them? Answer. Thank you for the question.
Non, pas du tout.
No, not at all.
C'est un concern que Pfizer a dit pendant nos négociations.
During our negotiations with Pfizer, they did raise that concern, but that's not why they've reduced their distribution levels.
Au cause de la réduction dans le pays, le Belgique.
It's due to a reduction in manufacturing in Belgium, and that is the only reason. Delivery has slowed.
Merci, thank you. We will take the next question. Opérateur.
Thank you, merci. The next question is from, la prochaine question est de David Thurton from CBC News. Please go ahead, à vous la parole.
Hi, good morning, everyone. Just want to ask this question to Major-General Dany Fortin. You said provinces will be affected asymmetrically by the Pfizer reduction. Does that mean that some provinces will get a greater per capita share of the vaccines that do arrive? How do you decide who gets more, who gets less? Can you just break that down for us, please?
Thank you, David, for your question. When I mean asymmetric, it's due to the distribution per capita across the country that is done in multiples of trays of 975 doses. And you can only break it down so far. So provinces that were expected to receive one tray receive none. Those are receiving two, if you cut, could receive one, and so on and so forth. So the impact will be felt more in some jurisdictions due to the overall number being different from one province to the next. But we are very mindful of that impact. And in fact, there are some adjustments that are made to follow-on shipments to adjust as a result of last-minute cuts that were made at the manufacturer that saw little to no reduction in some provinces and more severe in others, and will adjust back up for a per capita distribution. So we're very mindful of that, and that per capita distribution remains our overarching principle.
Okay, thank you for that. And this is for Dr. Tam. It's a question about immunity. What percentage of immunity in the population would make it hard for the virus to find new hosts? I mean, and maybe you can give us an answer based on, immunizations that we've conducted in the past. Totally understand that, it's only been a couple months since we've had these new COVID-19 vaccines. So at what point might we expect to see the R number drop below 1? Can you provide your perspective on that, please?
Yes, thank you for the question. And obviously right now, the main focus is to provide the initial vaccines to the most vulnerable populations at high risk and frontline health providers, so long-term care facilities. So one, might expect that as I said before, in a month or two, one would hope to be able to see the individual impacts, but also the activity perhaps in the long-term care facility to begin to be reduced, but that's what we're watching out for initially. What we don't know at the moment, and I do think data will be available, but we don't know the vaccine effectiveness in reducing infection as opposed to reducing disease. So we do know that the vaccines, they had amazing vaccine effectiveness against disease or symptomatic infection. We do not know if they, the degree to which they may reduce infection or asymptomatic illness. in which asymptomatic infection, in which case there is a chance that people who are vaccinated could still transmit to others. That is the unknown. Overall, though, the vaccine coverage to achieve population protection or herd immunity is expected to be probably somewhere closer to 60-70%. Now, having said that, if you had virus variants more transmissible, you may actually have to have more vaccine coverage to achieve population immunity. So that's why we're conscious of the spread of these more transmissible variants.
Thank you. Merci. We will take the next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Hélène Bugetti de Le Devoir. Please go ahead.
Question from Le Devoir.
Yes, my question is for Minister Anand. I just would like to go back to this reduction of deliveries by Pfizer. Not so long ago, and bear with me, I don't recall exactly if it was few days or few weeks ago, Prime Minister Trudeau told provinces that it was not a good idea to keep in storage the second dose because we should not be afraid of delivery problems. And yet that's exactly what's happening now. So in light of this event with Pfizer, do you still think it's a good idea to administer all the doses provinces receive instead of keeping the second dose just in case?
Well, thank you for the question. I want to stress that I'm the Minister of Public Services and Procurement. So the recommendations relating to second doses are not one that are within my portfolio at all. I will turn the floor over to Dr. Tam, who's a doctor, to answer the question.
Yes, thank you for the question. So as at the outset, as we all know, this is going to be one of the most complex endeavors in public health history. And one of the reasons is, at least initially, these smaller amounts and the unpredictability of supply. Now, I think we need to anticipate the unexpected as people plan, provinces and territories plan the vaccine programs. So they need to take that into account. For sure, there had been some schedules that were provided to provinces by Major-General Dany Fortin on a very regular basis. But I think one does have to prepare for uncertainties in the days ahead, as we've just seen. And so I think it is up to the provinces and territories to plan for that. The National Advisory Committee on Immunization and the Chief Medical Officers do support some flexibility in that dose interval given extraordinary circumstances, either based on epidemiology or based on the logistics and the vaccine supply. So that's how they will have to manage it. It's not easy, but that is part of the challenge as we implement. But I mean, mostly the decisions are in the hands of the provinces and territories.
Well, as a follow-up, Dr. Tam, with due respect, we have not answered a question. Is it a good idea then to inject all the doses and not keep the second dose? And as a follow-up, I noticed that today you're holding a virtual meeting after 10 months of the pandemic. So I'm just wondering, why did you wait so long before switching to virtual? And should the Prime Minister and other premiers throughout the country do the same and switch entirely to virtual?
So I think, the National Advisory Committee on Immunization have provided its recommendations and also the data that we know at this point. So the vaccine effectiveness, there is actually, quite promising signs that the first dose can provide protection to the population, but that you need a second dose for, the maximizing that immunity as well as the duration of immunity. So I think we will also get more information with time on the effectiveness of that approach. Right now, the recommendation is to, you can flexibly look at that interval for up to 42 days. But if that interval is surpassed, that data needs to be collected so that we can further understand this. But partly the decision is based on the province's epidemiology, where they want to cover more people, even if the first dose coverage in terms of vaccine effectiveness is not as good. There is some reasonable vaccine effectiveness, and so it's a balance between the number of people being vaccinated with the first dose and then following up with a second dose when you have the vaccine. So I think that's what the provinces are trying to balance at the moment. But that initial vaccine effectiveness after the first dose, particularly 14 days after that first dose delivery, does show some very positive direction in terms of efficacy. But it's just that there's a lack of clinical data, so data must be collected. And I think for the virtual meeting, we have been observing physical distancing in a giant room, with desks further apart, masking and hand hygiene. All of that has been observed in our on-stage virtual briefing. But we are very fortunate to have our IT colleagues help us set things up so that we can, add another additional option and layer of protection, particularly as we are in Ottawa, we're in Ontario, where the province has increased their public health measures in terms of more stringent public health measures. So we're just doing our part in observing that. But up to now, we have been observing all the other public health measures in terms of physical distancing, hand hygiene, masking, and in a very big room. Thank you.
Thank you. Merci. We will take a final question. Nous allons prendre une dernière question. Opérateur.
Thank you. Merci. The next question is from, la prochaine question est de Abigail Bimam from Global News. Please go ahead. À vous la parole.
Thanks for taking my question. For both Dr. Tam and Minister Anand, on rapid tests, Canada's Testing Task Force's report highlights that rapid testing is one of 4 priorities, but it's been months since some of these rapid tests have been approved here. Why are we so behind at rolling them out?
So maybe I'll start.
Maybe I'll start because I'll just talk about the procurement angle and then I'll hand it over to you. Is that okay, Teresa?
Yes.
So from a procurement, thanks. So from a procurement perspective, let me just say that we have procured over 40.5 million rapid tests, and we have distributed a large number of those to the provinces and territories. Over 14 million have gone to the provinces at the current time. And so our role as a federal government has been thus far to supplement testing regimes that the provinces currently have by procuring rapid tests. And we will continue to be supportive to the provinces in any way we can, not just with rapid tests, but of course with vaccine procurements and with covering the costs of those procurements as well as we have done. Dr. Tam, over to you.
Yes, thank you. So as Minister Anand has said, that over 14 million test kits have been distributed. Certainly at the Public Health Agency level, we've been working with the province and territories, chief medical officers, experts in providing guidance to support the application of a range of tests, including rapid tests, both the molecular tests and the antigen tests. And so part of our next stage, and I think it's great that the minister has struck this expert group to further support provinces and territories as they think about how to really step up on the application of those tests. So I think that was a very welcome report. And I have seen that there's many jurisdictions right now beginning to implement some of these tests, having validated the antigen test, for example, with the existing PCR testing. So I have, in my discussion and roundtables with provinces, seen that actually increase in the application of these tests. Where it has been extremely helpful has actually been in remote and isolated communities where these tests have played a key role. But also, I think now I think at long-term care facilities and other high-risk settings is some of the key places where I expect that province territories will be rolling them out. But so I think it is important as a very key pillar of our public health response is testing as part of contact tracing and isolation. So I think that right now, as everyone knows, we're experiencing resurgence in many areas of the country. Stringent public health measures are being applied during this period. And we want to see the peak of this epidemic, and we want to see it coming down sustainably. During that period of time is when we can scale up some of these measures to just add more layers of public health measures. Before people start easing things up, it's important that capacity is put in place.
And a follow-up question specifically on seniors. We know that the elderly are more vulnerable to COVID. I'm wondering how you feel, Dr. Tam, that people who are over the age of 70 who don't live in long-term care homes are not part of the highest priority groups in some provinces.
I do know that they are priorities of the National Advisory Committee on Immunization. Again, indicated that seniors and those certainly living in congregate settings, whether they're long-term care or residences actually for seniors, that's another retirement communities where there's congregate living are key. But it's just a matter of getting the supply in order to do it. So in the community, one might expect to start with the oldest members of our society, and then going down to younger and younger age groups by 5-year increments is actually part of the plan. So I think it's just a matter of the implementation timeline with the doses available.
Thank you. Merci à tous. Ceci met fin à la conférence de presse d'aujourd'hui.
Thank you, everyone. This brings today's press conference to a close.
Thank you, everyone.